Now, Premier Doug Ford is in London this morning with Health Minister Sylvia Jones making an announcement. Let's listen in.
For them to come practice here in Ontario, and our plan is working. Last year was a record-breaking year for nurses registered here. With over 12,000 new nurses ready to work, almost 6,000 of them were internationally educated. This is in addition to the pipeline for future talent in our colleges and universities that I know Minister Dunlop will speak more about. Just yesterday, we announced that we are also making it easier for Canadian-trained healthcare workers to come work in Ontario. A doctor from British Columbia shouldn't have to jump through hoops to start working here in our province. Ontario leads the country as the first to implement these as-of-right rules, with all of the goal of making it easier for you to connect to care closer to home. Because we know the status quo isn't working. We need to move forward with fresh and bold ideas to address more healthcare professionals in Ontario. Because when it comes to your health, our entire province is stronger when you have access to the care you need, when and where you need it. And we will continue to work with our partners to make it easier, faster, and more convenient for you to connect to care no matter where you live in Ontario. Thank you, stay well, and it's now my pleasure to pass it over to Minister Dunlop.
Well, good morning, everyone. It's great to be here today alongside Premier Ford and Deputy Premier and Minister of Health, Sylvia Jones. We are all keenly aware that the COVID-19 pandemic has demonstrated how vital healthcare professionals are to the health, long-term care, and the well-being of the people of Ontario. Through Ontario's plan to stay open, our government has taken the necessary steps to strengthen the supply of healthcare professionals in every corner of the province. And we recognize that investing in the future of Ontario's healthcare system starts with expanding high-caliber education for those on the front lines. I've been working closely with the Premier and the Minister of Health to ensure that we are not only fostering education for healthcare professionals, but that we are also addressing specific regional and community healthcare needs across the province, especially in this time of need. This includes expanding medical school seats by 160 undergraduate seats and 295 postgraduate positions over 5 years, as well as an additional 1,500 nursing spaces beginning in 2023-24. And as part of our government's plan to stay open, we introduced the Ontario Learn and Stay Grant, which addresses the pressing needs for qualified professionals in communities across the province. The grant launches this spring for the upcoming fall 2023 academic year. It will provide upfront funding to cover the costs of tuition, books, and other educational costs to post-secondary students who enroll in priority programs in regions that have been challenged by staffing shortages. And importantly, commit to working locally when they graduate. This means that these students will graduate with no debt tuition if they work locally in their fields after graduation. Not only are we giving students the training for in-demand fields in Ontario, we are also ensuring that communities across the province get the workers they need to support their local labour market needs. Let's look at London, for example. Through the Ontario Learn and Stay Grant, graduates of Fanshawe College's nursing programs will be able to make immediate impacts in local hospitals, like the London Health Sciences Centre and St. Joseph's Hospital, long-term care homes, and other facilities. This is an historic investment in our students and in the future of our healthcare workforce in Ontario, and will be a game changer for communities across the province. As we continue to prioritize...
We've been listening to Premier Doug Ford along with Sylvia Jones and making an announcement regarding the Learn and Stay grant program to train more healthcare workers in the province. We're going to go back to London, and Premier Doug Ford is speaking. Let's listen in.
Innovative. We need to be creative. We need to look to other provinces and countries to see what they're doing differently and borrow the best ideas. We also need to be clear. Ontarians will always access health care with their OHIP card, never their credit card. Our goal is simple. Whether it's an emergency in the middle of the night or a problem that's been bothering you for years, no matter where you live, we want to connect you to more convenient care closer to home. Together, we've come so far. Since 2018, over 60,000 new nurses and nearly 8,000 new doctors have registered to work in Ontario. In fact, last year was a record-breaking year for new nurses in Ontario, as you heard the minister say, with over 12,000 new nurses registered and ready to work, and another 30,000 nurses studying at a college or university, providing a pipeline of talent and reinforcements. We've added 3,500 hospital beds, with another 3,000 more under construction. We're helping 30,000 more seniors find a long-term care home, and we're upgrading another 30,000 long-term care home beds. But when it comes to your health, we must do more, and we're going to do more. Like I said, as we connect people to more convenient care, we need to be bold, innovative, and creative. And today, we're doing just that. When we released our first plan to stay open last March, we launched an innovative new program called the Learn and Stay Grant, starting with nurses. Learn and Stay pays for the cost of tuition, books, and other supplies. In return for a commitment to stay and care for people in underserviced communities. The program started with 1,500 students. We thought that's great. 1,500 students, that's fantastic. Today, I'm thrilled to announce the Learn and Stay Grant will expand to 2,500 students. On top of nurses, the expanded program will now be open to others in-demand professionals, including paramedics and medical lab techs. We're bolstering our workforce, building a pipeline of healthcare talent for growing and underserved communities. Students can apply for full, upfront funding at select colleges and universities. If they commit to staying in their region, working for up to 2 years after graduating. That's right. We'll pay for your tuition, your books, and other direct educational costs for a practical nursing program in London, for a paramedic program in Sudbury, or for a medical laboratory program in Windsor. My friends, this is a real win-win. We're providing students with opportunities for a great education and a rewarding career. And we're increasing the number of healthcare workers in underserved communities so that Ontarians in every corner of the province get the quality of care they need closer to home. As I said before, the status quo is not acceptable. A lot of people out there, they want to have this endless debate about our healthcare system, and you've heard it for decades, not years, but decades. But the people of Ontario, all they want is action. We're being bold, we're being innovative, we're working hand in hand with our colleges, universities, and healthcare partners. We're making it easier, faster, and more convenient for you to connect to care, because it's about you, it's about your health. Thank you, and God bless the people of Ontario.
Okay, we'll now take questions. Just a reminder, it's one question, one follow-up.
Premier Ford, this is Rebecca with London News Today.
Hi, Rebecca. How are you?
Good, thank you.
Good.
So one of the key reasons behind the nursing shortage that we've been seeing here in Ontario is that first responders are feeling a sense of burnout. So will there be any type of support being offered to these professionals as these changes are being implemented to help those who enter the profession stay in the profession?
Yeah, before I pass it over to the Minister of Health, you know, yes, there's burnout with the nurses. They're doing a great job, but I think a lot of people got burnt out over the last couple of years of this pandemic, no matter what sector. But at the end of the day, we had the largest gain we've ever seen with nurses, over 12,000 of them. And I just want to, again, I thank them all the time. I appreciate the hard work they do, but I'll pass it over to the Minister of Health. Thank you.
Thanks for the question. You know, there is no doubt that during the pandemic, all of our first responders, everyone who continued to work through a very challenging time, were under stress. You know, there were things that we didn't know about COVID-19 that we now know, that we have comfort in, specifically related to nurses working in our hospital and in our community systems. We, of course, did give a $5,000 retention bonus as an acknowledgement of how challenging those times were. We will continue to support our frontline responders, regardless of where they work in community and the jobs that they do, because we understand that it has been challenging. We've learned a great deal, but everyone truly stepped up, whether it was our paramedics, our firefighters, our police officers, our nurses, corrections officers. The list of individuals who went above and beyond to protect the citizens of Ontario was not unnoticed by our government and their friends and neighbors. Thank you.
Jennifer Beeman, the London Free Press. We're doing a lot of cool things in London right now with ambulatory care. Our hospital, LHSC, has a surgery center across the street from its main, Victoria Hospital. St. Joe's is doing similar things. Is your intent to prioritize these sorts of hospital-run ambulatory care initiatives over, before investing in more private or for-profit community surgical and diagnostic centers?
Well, we want to support everyone across the board. As I've said, we've been pouring money in. Since 2018, we've put over $14 billion into healthcare. But again, and I apologize, the best person to answer this is the Minister of Health. Thank you.
Yeah, thank you. It's not an either or. We know that we have people who are waiting too long for cataract surgeries, for hip and knees, and that is an impact on those patients, those individuals, because they want to be part of community. They want to be back with their families, back in community, volunteering, working. And so for me, it is how do we make the system stronger? And the way to do that is not only to absolutely invest in our hospital system. We did that with a surgical recovery fund of $300 million that actually allowed hospitals, when they had the capacity, to expand their operating room hours. But we've also done it now with expansions in additional cataract surgeries that could be done in community. And I have to tell you, as recently as last night, I was talking to an individual who had their cataracts done last week, and they were grateful that they would not have the long wait times that we are unfortunately seeing in the province of Ontario. So we will continue to work with our hospital partners to expand their ability to offer surgeries in their operating rooms, but we will also expand community opportunities, because we know that there are over 800 that are existing in the province of Ontario. They're doing excellent work. We just need more because we have a growing and aging population.
Just this week, London City Council, Middlesex County Council, we're discussing ways to push the province to really kind of revitalize and change the way paramedics do their work here. They want the province to green light things like treat and release protocol changes and, changes to the way dispatch is managed locally, along with the ability to drop patients off at places other than an ER. I just wanted to know if this is something you're entertaining as a government, sort of changes to paramedicine to make things a little bit easier for this sector.
Yeah, and I'm probably going to pass it over to the mayor or the warden on this one, but we had that discussion up there about the dispatch and a few other areas, but we're always open. I always say, at Queen's Park, we always listen to the professionals, no matter if it's the healthcare frontline workers or the CEOs or the paramedics. And when you come to a great city like London, no one understands their city better. For instance, the mayor, the warden, MPP Rob Flack, they understand it. That's where we take our lead. And I just don't believe in Queen's Park sitting there dictating to a region without their collaboration, cooperation. So warden, mayor, who wants to step up, or you both can come on up to the mic here.
Well, thank you very much for that question, Jennifer. You know, it's great that both the mayor and myself as the warden can be here, because as much as Middlesex County is the service provider for paramedic services, this is a partnership. And I can assure the
We've been listening to members of the provincial government announcing the expansion of the Learn and Stay grant program to train more healthcare workers and provide more education and funding and tuition and books for new healthcare workers as we move forward.